Hi, it's Sally from Baby Thrive. I have always with me a big bag full of bits and pieces of equipment that I show to parents. So today I was going to show some alternative feeding methods. If your baby's not able to latch at the breast well, if they need a bit of a supplement or a top-up to help them, maybe some formula or expressed milk might be necessary. A lot of parents are nervous of using a bottle. They're worried that their baby will struggle to go between the breast and the bottle. Actually, what we know about this is that there is less of a case of nipple confusion, which is slightly dated information, and more a preference for the easy flow of the bottle. So on my website there's a blog called Bottle Feeding Breastfed Babies, and that shows a technique which is known as intuitive bottle feeding or paced bottle feeding, in a way that you can actually use a bottle to feed your breastfed baby whilst protecting your breastfeeding journey. If that's not the case, or you're using really tiny amounts in the early days, there's other options. So this one you might have seen before is a colostrum syringe. You can use these antenatally to harvest colostrum. They're actually so tiny. This is 1 ml. It's a very tiny thing. It's got a little cap on it, and you can use this. If you manage to harvest some colostrum, you can either draw the colostrum into it, or you can take the plunger off it and fill it with colostrum, and then you can gently feed this to your baby using this tiny syringe. If your baby's needing larger portions, if your breast supply is better established, or if your baby is getting a bit bigger and they need a bigger portion, another option is a periodontal syringe. I'll try and make it so the camera focuses. Right, see this really unusual little pointy tip on it? This is called a periodontal syringe. This one's 12 ml. And actually, you can encourage your baby to suck your finger, or even at the breast if you're very clever. And while your baby's sucking your finger, you can gently slip the periodontal syringe into the corner of their mouth, and really softly, whilst being quite perceptive about when they're actively sucking and feeding, you can serve them up a little portion of top-up in their periodontal syringe. Another really common popular option is this one. Infant feeding tube. This is actually nasogastric feeding tube. It's designed to go, it's for babies that are nil by mouth basically, and it can go up their nose and down their throat and into their stomach. That's something for hospital use obviously. But you can use these to finger feed a baby, which is a really good option in the early days, where you open this little cap at the end. You have a little portion beside you of expressed milk or formula. And the other end, this is all packaging. I hope you can see that this is actually a very tiny thing in here with a very soft end on it. And you use some surgical tape to sticky tape that to the end of your finger. And again, you encourage your baby to suck your finger, and they have to actively suck and form suction and work lapping their tongue to draw the milk up the tube, so they can't be overfed at all. They have to actively feed. And I think this is a really good option for giving babies some milk when they can't go to the breast, because they're really learning they have to actively feed. They can't just drink it down without any effort. And these, of course, with any of these options, you need to ask your local IBCLC or breastfeeding support service and understand the way that you need to clean them and so on, and how to look after them and where to source these things from. So it's just a little summary. Another option, I've got these couple of just household items. You can use like an egg cup or a shot glass, and you can gently feed your baby with a cup or maybe the lid of your bottle. They can actually drink quite well that way. So don't think that it has to be a bottle if you're a bit stuck in the early days and your baby's not easily going to the breast. Let me know how you get on. If you have any questions, there's further information about some of these options on my blogs on my website.